Having an effective COVID-19 vaccine is a victory, but now one of the challenges we face convincing people it's safe to get.
That's especially true among some people of color. Their mistrust in the public health system is long and well documented. Our Paula Tutman looks at that challenge and what's being done to overcome it.
Well, certainly a lot of minorities, people who feel disenfranchised, marginalized, and devalued, have an historic reason to mistrust medical science and its processes. Start with inequities in access to medical care and, of course, well-documented medical science abuses against Black people in this country in particular. But now there is a move during this pandemic to rebuild a trust in not only this vaccine, but in the medical community in general. Dr. Kelly McFarland had big motivation to enroll in the Moderna vaccine trial at Henry Ford Hospital.
I wanted to do as much as I could to protect me and my family.
And then there was her cousin who died of COVID-19.
I was really affected by the passing of my cousin, Skylar, feeling really helpless at that time.
As a doctor and as an African American, she knew without a doubt
we need diversity in clinical trials, knowing that the African American community needs to be represented in the clinical trial.
Strong efforts were made to make sure minorities are represented in the vaccine trials, and history did not make it easy. Henrietta Lacks, whose cervical cancer cells were used for research without consent. The Tuskegee experiment, 600 Black men lured into a study with the promise of free health care.
There was an experiment to develop some sort of a cure for syphilis, but they did not tell them what they were really doing. And they experimented on African-American men and women. As a result of that experimentation, some women were unfortunately not able to have children going forward. Some people even died as a result of that.
Yes, history is a problem when it comes to minorities and medical science, but it's not the only one.
There's a disparate number of people of color who are receiving the brunt of the effects of COVID-19, and that's a number of factors. The poverty rate, the lack of education that goes with that, the lack of access to health care.
Reverend Wendell Anthony says he is glad the state is identifying the racial disparities and doing something about them. And he knows Black people are skeptical, and that is why he is speaking out.
So we end this. This is not Tuskegee, y'all. We need the vaccine. I'm going to take the vaccine. Now, I'm taking it because the research is there. I trust science.
Dr. Kimberly Dawn Wisdom is the Chief Wellness and Diversity Officer at Henry Ford Hospital. She says she and others are working with faith-based groups to build trust in the vaccine and the entire medical community.
When a pastor or a bishop or an imam or someone that plays a leadership role in the faith-based community, that also bodes well in terms of building that trust.
As a Black man, it's very important to me that people are able to have their questions answered and concerns allayed. And so the task force is putting together a plan working with across state government and also with partner institutions to make sure that people have a place to go to get these questions answered.
The Michigan Coronavirus Task Force on Racial Disparities is making education about the vaccine a priority. And Dr. Wisdom says it is important that people ask questions.
Also watch what the scientific community is doing. Look to see when physicians are getting their vaccine. I would say not to make a definitive decision and say I'll never get the vaccine, but just say no right now or not yet. But to keep that window of opportunity to receive the vaccine open.
One thing everyone we talk to can agree on, however, is that education is key. Educating the entire community and making sure people are not afraid to ask questions. Back to you.
Okay, Paula, and Dr. Wisdom says it's not just what people hear, but what they see. She says they've had success this fall with more people choosing to get the flu vaccine because of who else they see get it. If you want to see more on this story, there is an extended cut on our website. Just go to clickondetroit.com.